Okay, we're good to go.
Okay, I'm just getting my notes organized here, sorry. Okay, and I'm going to press record on my end so that I can send this out to the gallery as well. So I will start with, so we had a rollout starting today using AstraZeneca at pharmacies. One of the frustrations we heard was about how much supply was provided. Can you tell us how much AstraZeneca now is being provided by pharmacies? How many appointments were booked today? If we know that, and do we expect any more AstraZeneca to be provided soon for these pharmacies to distribute?
So the major issue is, I think everybody knows, Richard, in limiting any vaccination campaign is the amount of vaccine. We have the vaccine we have, and we've been delivering it at an extraordinary rate to very focused populations. That's happened from the beginning. So whether it's Pfizer or Moderna or AstraZeneca, we're limited by the amount of vaccine we have. And I think our teams have just been doing an exceptional job. Today, every First Nations community, every one across all of British Columbia have had access to a first dose. When you consider how diverse those communities are and the locations around the province, that's extraordinary. With respect to AstraZeneca, we have in BC, or have had in BC, a total of 68,000 doses so far that have arrived and are actually here in British Columbia. In this program right now, therefore, we have 13,500 available immediately that are in the hands right now of pharmacists. We're expecting from the federal government, and this was expected in advance, this is not the United States shipment, 43,000 more on Friday that would be added to that. So 13,500 currently, that's what we have available, all of it, and then 43,000 more when it arrives on Friday.
And those appointments have not been booked yet for vaccine that's not here.
No, that's right. They've been booking some appointments. As you know, the reason for this is very straightforward and was laid out on Monday. There was the decision to suspend for people under 55 AstraZeneca, which changed the program. That was a decision that was made nationally based on international evidence. And so this is a response to that. Some of that those 13,500 doses will expire. So we want to get them into people's arms soon, while continuing with our primary campaign, which is an age-based campaign.
One of the concerns we heard about was that in London Drugs, the appointments were booked up all last night, even before they were supposed to be booked. How could something like this have happened? And pharmacies, as you know, have strong relationships with the community. Were they allowed to prioritize their customers for booking these vaccination appointments?
Well, I saw some of that latter discussion on social media. It was brought to my attention today, and I don't believe that's what's happening. This is a relatively small amount of vaccine that we needed to move on right away. And so there are a limited number of appointments. About 112 pharmacies have online booking systems, and so you'd expect those numbers, given how quickly we've been booking appointments everywhere, would be filled up. So some of that has occurred. We came to an agreement with the pharmacies. It makes sense. They did about 3/4 of our influenza vaccines. The allocations to pharmacies were based on those influenza vaccines, right? So that we knew approximately what each pharmacy had been doing. And they're proceeding to deliver these vaccines to people in the age groups, the 55-64 age groups. And I think all of that makes a lot of sense. I'm very impressed by how quickly the BC Pharmacy Association mobilized after the decision by NACI to change the advice on AstraZeneca. And I think the program is going well. But let me just say to everybody, the limit on that program is the amount of vaccine, as it is with all of our vaccines. As of today, we'll have immunized, I think, in the neighborhood of 15.5% of eligible British Columbians, which is very good, and it's basically what we've received from Ottawa. But obviously, if we were receiving more, we'd be delivering more, and that's the main, really the only limitation on our immunization campaign. Otherwise, in every area, our teams have done an excellent job.
There's also been some pharmacies that have been saying they aren't getting AstraZeneca, but we're on the list, and some don't have it yet. Like, is part of this confusion adding to people's anxiety around this vaccine?
Well, with great respect, a decision was made on Monday to change the way we use AstraZeneca nationally, right? And we've responded to that by ensuring that as quickly as possible, we immunize people for whom AstraZeneca is safe and proper and is going to be very effective, right? So that news came essentially on Monday, the announcement by NACI. We responded immediately to that. So by Tuesday, we had a plan in place. On Wednesday, it started being delivered. I think that's pretty impressive. And so naturally, because there's way more demand than even the amount of vaccine that we'll be adding by the end of the week, the 43,000 we'll be getting, we're told we're getting, and we believe we're getting on Friday from the federal government. There's way more demand than that. There will be some people who are in those categories who won't be able to access the vaccine, but I think that is an extraordinarily quick reaction, effective reaction, and efficient reaction to a change in circumstance. And that's exactly what you'd expect public health to do. And we're using our community partners in pharmacy, and they're doing a great job.
I'm sure you've heard from a lot of people in this age range between 65 and 72 who saw the province moving very quickly, setting up registration appointments right up to, if memory serves, 1968. And then all of a sudden those updates stopped. So there's a few pieces here that we're hearing from people. One is, why is the 65 plus not included in the AstraZeneca rollout in Metro Vancouver? That's one piece.
Yes.
And another piece is, what is the slowdown for registration for the 1949s, 1950s, 1951s after we saw updates from people daily? We've now not seen one since Saturday.
Well, we had updates, I believe, on Monday, so there are updates. In addition, this week, we've added 150,000 people who will be getting letters, or will be getting, or have received letters, who are clinically extremely vulnerable, who are added to that category. So that's 150,000 more people eligible. And every age cohort you move on to is larger than the previous one by definition, right? There's more people 72 than 73 and so on. So that's what's happening. We have larger age cohorts, and we added 150,000 clinically extremely vulnerable people, people who have cancer, people who have adults with developmental disabilities, people with very serious conditions. And I think everyone would agree that that was the right approach. It was added at the time based on the advice of our clinical teams. So there hasn't been any delay whatsoever. In fact, we're proceeding very effectively with our Pfizer and Moderna campaigns. The reason why we didn't say 65 to 69 is that those groups are very soon going to be eligible for the Pfizer and Moderna. So we felt that what we would get would be a very inconsistent take-up in that group. So what we're trying to do is add on here, is to speed things up. And I want to say to everybody, the fact that we've done this, everyone in the age-based campaign, which is all of us, right, is going to be faster because we're doing this. It's moving everything faster. So we'll have done this week with this amount, 13,500 more with AstraZeneca, then the 43,000 more. Those groups of people will be vaccinated, and so it will speed up every other age cohort after that. So this is good news for everyone. It's an efficient response, and the work we're doing with community pharmacy, which is going to grow and grow and grow throughout this vaccination campaign, and was extraordinary on influenza, is going to continue.
When should we expect the 1949 group to get their news about registration?
I think very soon, and we're updating that consistently. What we want to do, like this morning in our call centers, we received yet another remarkable number of new appointments, because the groups we're taking are the groups that are eligible now, the age-based groups, plus all those that are clinically vulnerable. So we added to these groups basically 150,000 people, and naturally that means we don't move as quickly, because the assessment was, and this is a clinical assessment, that people in those clinically vulnerable categories, because of their vulnerabilities, were equivalent in vulnerabilities to people in the age categories at that point. That's why the decision was made, right? And I think it's the right course. There's a lot of people with who are clinically vulnerable, who have been hiding out in this period, who are struggling. And we've seen this from the evidence. I think the first presentation we made about COVID-19 in BC talked about how some categories of people with chronic disease were more vulnerable based on the evidence in Wuhan at the time. And that continues to be the case, and that's why it's been set up this way.
Last question on AstraZeneca. Island, why is AstraZeneca only being offered in the lower mainland to people 55 to 64, I guess? I've heard some confusion on that, 65, 64 weeks, but I'll leave that for now. Whereas there are high cases in some areas like Brooksville.
Well, overall, of course, there's a very high caseload in Metro Vancouver, and we've seen that. But really, it's for efficiency's sake as well. We wanted to move on some of this vaccine because we needed to in this period, so we needed to move quickly. And I would say this, that there are some differences between communities and between health authorities. Vancouver Island has received more proportionately of the age-based vaccines because they have more elderly people in Vancouver Island. The take-up of vaccine in the 90-plus category, the 85 to 89 category, is way higher in Vancouver Island. So in that sense, an age-based campaign favors Vancouver Island. There are many more Indigenous communities in Northern Health, remote Indigenous communities have had access, and that favors Northern Health. We've focused on the Surrey School District, as you know, for immunization. That favors Surrey. But in general, it's pretty even across the board. And so these things, there's some differences that happen from time to time when you're engaging in this big logistical operation. But I can tell people on Vancouver Island that the level of vaccine hesitancy there is low, the vaccine being delivered is high, and people are doing an excellent job. Case counts have risen on Vancouver Island. Quite true, they've risen on Vancouver Island, such that the test positivity rate on Vancouver Island is higher than it was in Fraser Health about a month and a half ago. So that's not low, it's 5.1%. And so the 7-day rolling average of case positivity. So we're concerned on Vancouver Island. But again, the immunization campaign, it's being rolled out across the province. Different areas have slightly different conditions. And there's some small communities where we're doing an all-of-community approach, as you know, in every health authority. And that doesn't mean they're being favored. That just means we have to be practical. If there's 300 people in a community, it doesn't make sense to go and find the 3 people over 90 and immunize them and then leave and then come back for the rest. So we're doing it differently in different places, just a little bit.
All right, so let's go to Ski Hills now. So I'm sure you've seen the video of the party at Big White hours after new restrictions were announced. If it is a small minority of people blowing it, quote unquote, for everyone else, why is there not more enforcement, fines, arrest charges, and better crackdown on the programs?
Well, first of all, I think we have to put it in context. I don't know about you, Richard, but because I don't think I'm a good example. I go to just about as many parties now as I did when I was 23. But I think that young people are more socially active, but they're also in workplaces that are often more engaged in a social service, in the service industries. They're more likely to be there. So there's lots of reasons why young people are more vulnerable. But what we saw in a short period of time, last week, March 26th, I believe it was, I think it might be March 25th, 438 people in one day between 20 and 39 tested positive for COVID-19. That the 7-day case average for people 20 to 39, the 7-day rolling average, so that evens out the day-to-day changes, has gone from went in about a week from the low 200s to the mid 300s. And so those were significant changes. And so in addition, you see the median age of the P1 variant, the Brazilian variant, which we saw 100 cases yesterday, new cases yesterday. The median age is 28. So I think the issue for young people is that, and this has been seen all over the world, in France where they're having issues now, in other parts of Canada, everyone is seeing some of the same thing, is that A, there's a significantly increasing level of COVID-19 and number of cases amongst young people. B, that can lead them to seriously put other people who are more at risk. And C, the risk to them is pretty serious because this is a vicious, nasty, awful virus. And everybody should do everything they can to avoid getting it. And I want to say finally, on an individual level, we've seen in the last year the President of the United States test positive for COVID-19. The Prime Minister of the United Kingdom rushed to hospital with COVID-19. The President of France, I believe, tested positive for COVID-19. All kinds of other people have. We know that it affects more vulnerable people more, but we know also that it can reach and people can see it transmitted, because this is a virus that lives to transmit. So, it's very important that we support people who are sick, and we encourage them, and we have them participate in our contact tracing. And so public trust is important. We're going to continue to work with everybody.
All right, let's talk about restaurants. We're hearing from some concerns that restrictions are going to be inevitably extended past April 19th. Should they plan accordingly for that to happen? What do you think about staffing issues or food issues or other things that may catch into them without knowing for certain if this ends on the 19th or will be extended?
So the changes we brought into place came into effect yesterday, right? Midnight on Monday night, midnight on Tuesday morning. And we know that our case counts this week are going to reflect what happened last week, right? People got sick last week, they test positive after they get sick. And so it's going to take some time for us to see the impact of these measures reflected. In addition, we're obviously vaccinating every time someone delivers vaccine here. We're vaccinating more and more people. It's up tomorrow. It'll be up near 700,000 people, right? And we're going to continue to do that. So there are some things pressing in the other direction. The measures themselves, I think, many people I know rededicating themselves as they have been throughout this thing to staying safe. The impact of the immunizations. It's us and the vaccine against COVID-19. I think it's too early to say. The reason why April 19th was chosen as a date is to provide ourselves enough time to see the effect of these measures, and hopefully to see case counts, to see the curve bent down. That's the intent of those measures. So what we're going to try and do is prepare so that we're able to let people know in advance of further changes, that changes may be coming. But I think it's very challenging. I did hear from people that said, and this is legitimate, that it's very short notice for us, and it is. But you really, once you've made a decision for public health reason, you can't wait 2 or 3 days to implement it, because you risk seeing dramatically more transmission in those 2 or 3 days. Once that decision's made, it has to be implemented. But obviously, we're concerned. These measures are not taken lightly. I know the profound effect on the lives of thousands, even tens of thousands of people, those measures, and they won't be in place one day longer than they're needed.
This is for Katie Rosa. So also on the restaurant, regarding outdoor patios, why is full meal service a requirement? Outdoor patios are deemed to be safe with limited transmission. What difference does it make if a full meal is served or not?
I think that's been the assessment of public health, that the coming together, if people come together in a cohort for a full meal, that's a different proposition than, say, getting together for drinks. And so that's the decisions that's been taken. It's a control measure, and I think it's the right measure. It's a prudent measure, and there have to be some rules, and there are in place now. For example, we're going to have some outdoor church services based on rules, but the rules still have to be followed, and these are the rules that allow patios to continue to be open. I want to encourage everyone in BC who's able to do this, to consider getting takeout from restaurants, to support their local restaurants, because this is, as you know, a very significant thing for all of them. So the rules are in place. I think they make sense. I think people understand them, and that means if you're on an outdoor patio, you're there for a full meal and not for something less than that.
I'm aware we're taking a lot of your time.
No, I'm good. I could do this for hours, Richard.
Private health has mentioned that variant cases could double or triple in the coming weeks, largely due to spring break travel. How concerned are you about this, especially considering many of these travel destinations like Tofino are remote communities with vulnerable populations?
Well, that's why I say to everybody now, there should be no non-essential travel right now. That's our guidance, and we don't want people to be traveling where it's not necessary. If it's necessary for work, if it's necessary for health, if it's necessary for reasons that could be reasonably seen as essential, then one can travel. So I think that's the first thing. It's important that everyone reflect on every decision. And I think if anyone is in any doubt about anything right now, with case counts that have reached more than 900 on individual days in the last few days, the answer, if they're in doubt, just don't do it right now. I think that's pretty straightforward. Yes, we're concerned about variant cases. If you look at other jurisdictions, what's happened generally is the variant cases haven't necessarily driven the case count, although they would somewhat, but they have become a larger share, and we would expect that. And you see that there's quite a bit of variability. Right now, we don't have a lot of cases, for example, of active cases of the P1 variant. We have fewer and fewer cases. I think one active case of what's sometimes called the South African variant. And we have obviously a lot of cases of the UK variant. The UK variant is overwhelmingly in Fraser Health right now. The Brazilian variant is overwhelmingly in Vancouver Coastal Health, although a significant number in Interior Health. But there is the potential for a rise in those variants, and that's an argument for everyone to be prudent about travel right now. It's just not the time for non-essential travel.
Yeah, I'm looking at 4 more here, and that will be the end.
Okay.
Are you concerned that the public is confused about these new guidelines? I mean, we're talking restaurants, mainly gyms, potentially. There was some uncertainty about whether masks in schools are required or recommended. Some businesses, like recreational facilities, serve food, like bowling or pool halls. They were unsure about how they can operate. I know that some gyms received a lot of phone calls around what they were allowed to do. Like, are you worried there's been confusion about some of these guidelines?
No, I think we've been through this for a while. I mean, I think some of the challenges, there is great if a restriction were to be removed, as they are when they're being put on. But I think we've gone through this with restaurants before. I think people understand the purpose of the rule. It's basically no indoor dining, so it's takeout and some for a full meal service patio. That's pretty straightforward. No group fitness classes. That's pretty straightforward. Continuation, we don't have the variants for indoor church service. That's pretty straightforward. So I think there's actually significant understanding. Of course, it takes a little while when one has concerns about things, or it involves your business trying to figure out how you're going to put these in place. But we're now a year into the pandemic, and I don't think that there are a lot of people who are uncertain about the changes, but obviously for many people, if you're running a restaurant, or a loved one's running a restaurant, or you're working in a restaurant, or you're working in a gym, obviously this is a big thing. If you're a fitness instructor, it's a significant thing. So I appreciate that that putting in place new measures in response to what we saw as a spike in case counts was hard for people. I think people understand what the measures are. I think obviously, like everybody else in the world, and me and you and everyone else, they wish the pandemic were winding down, but we're in the thick of it in terms of case count, just as we're immunizing more and more people every day. And today's another example of both those things.
This one's just a quick one, because I don't think you have an update. I don't think the background on it, though. But for the parallel AstraZeneca for priority workers, there's no update on that, right? We're still in the holding pattern there.
That's right. The decision for people under 55, the assessment is being made about the safety signal, and so there's no update today on that, and that's why we're proceeding with 13,500 AstraZeneca that's there, and the 43,000 that are coming. I believe that their origins in South Korea. I think that's where it came from. From Canada that are coming on Friday. So that's why those decisions have been made, so we can proceed, so that we can immunize people as fast as possible. And that's the reason those changes were made, and I think doing them quickly and efficiently and using our pharmacies makes a lot of sense.
Last one, and then one more I'll say at the end. Regional approach, you took a regional approach to closing ski hills. Would you consider regional approaches to things like indoor dining? For example, given Vancouver Island is only 7% of the cases announced Monday, why not allow indoor dining to continue?
Well, 7% is more than it was a week ago in terms of cases. I think people don't get sick in percentages, they get sick, right? And the test positivity rate on Vancouver Island has also risen, and it has risen in all of the health authorities. It's obviously very high in parts of Northern Health, And I'll just give you one example, Richard, which will be of interest to people, I think. In the last 4 days, there have been 67 test positive cases of COVID-19 in Prince Rupert. Because this reflects previous weeks and the fact that it takes some weeks after you're immunized for you to be safe, right? To be safe and for the vaccine to take full effect. Well, that tells you the risk in communities. And so there's risk everywhere in BC, in every health authority. Yes, it's significantly worse in Metro Vancouver right now and in parts of northern BC, but it's a significant risk everywhere. So with respect to ski hills, we took a response with respect to one resort municipality, Whistler, and we made a change that was necessary based on the evidence. And I think that evidence is pretty clear to everybody now. But in general, I think there's risk everywhere in BC. COVID-19 is everywhere in BC, and that's why we really need people to dig in and follow the measures as we're ramping up our immunization efforts every day. And as I say, when vaccine comes in, the only limit to our immunization is the vaccines that are coming in. And people say, well, you could have had more capacity or you should be open 24/7. We only have so much vaccine, and that's what we're delivering. And I think our teams are doing a great job at delivering it.
Yeah, thank you. I'm going to ask in French, but I have to run on in W, so I'm going to ask en français.
Go ahead.
I will attempt, and then I will let you answer in French. We'll hang up and listen on the radio for your answer.
Okay.
I can
Ask
ask it in English. Please.
it in English. Question in English, answer in French.
Je veux savoir quoi arriver avec AstraZeneca à les pharmacies et est-ce que la province not going to quit? In French, explain to me sort of what happened with the pharmacies today with AstraZeneca. Were we just overwhelmed with the number of people who wanted access to the vaccine? And what do you say to those who are frustrated with the way that the AstraZeneca is being rolled out?
Écoutez, la seule limite sur la distribution de AstraZeneca ou des vaccins en Colombie-Britannique, c'est ce qu'on reçoit d'Ottawa, n'est-ce pas? C'est une limite véritable. Et donc, on a maintenant 13 500 doses ici dans notre position en Colombie-Britannique d'AstraZeneca, et on va les distribuer cette semaine par voie des pharmacies, et je pense que c'est normal. On va ajouter 43 000 vendredi de la part du gouvernement fédéral, et on va ajouter ces 43 000 à cela. On sait bien qu'il y a des centaines de milliers de gens qui qualifient pour AstraZeneca dans ces catégories, mais il faut agir. Il y avait un changement dans l'utilisation d'AstraZeneca lundi. On a répondu mardi et on est en train de vacciner des gens mercredi, ce qui est extraordinaire. Et je veux saluer des pharmaciennes et des pharmacies en Colombie-Britannique pour leurs efforts. Merci beaucoup. Thank you very much.